So, good afternoon. It's truly an honor for me to be a part of this session of AIOS. The topic which has been given to me might be of interest for most of you. As fellowship interviews for ophthalmology kick into high gear this season, I will try to throw light on some important aspects of it. So, of the important decisions we have to make in life, career development calls for critical thinking. To me, the word fellowship means a friendly association, especially with people who share one's interest. When you think about fellowship, you might have many questions in your mind. So, should I do a fellowship? After 5.5 years of MBBS and 3 to 4 years of residency, the last thing on your mind might be more training. Ask yourself few questions. Are you passionate about a narrower focus? Will additional training help you reach your goals? Do you know enough about the specialty? Does the lifestyle suits you? Does it make sense financially? So fellowships are actually an opportunity to do something exceptional. Fellowship is all about practical experience in the form of surgical and clinical work which will help you develop the skills and experience required to work in your real practice. Sharpen your professional skills. You'll learn public speaking, community organization, leadership skills, hands-on experience, research. For people, those who are interested in research, fellowships open many doors for them. Personal confidence, you get a career boost, and you develop good leadership skills. So the next which fellowship to choose? Your training during residency plays an important role in making this decision of long-term or a short-term fellowship. Someone who is applying for short-term fellowship in a reputed institute has more chance of getting selected than a long-term fellowship. But competitive fellowship makes your resume stand out. So what do you need to answer yourself is, how were you trained during your residency? What do you want to do at the end of your fellowship and beyond that? Do you plan on a career in private practice or academics? Do the program you are looking at have the opportunities to get you there? What if the circumstances changes? For example, your ideal mentor moves to a new institution. The more specific and honest you can be, the better informed your decisions will be. So which subspecialty to consider? You have an option of doing fellowship in all possible subspecialties in ophthalmology, right from cataract, cornea, refractive surgery, retina, and so on. Choosing a subspecialty perhaps is the most important choice of your young ophthalmology career. It is what you will be doing, most likely you will be doing on daily basis for next 30 to 40 years from now. So answer yourself, is it something that will interest you and keep you stimulated for next 30 years? Prioritize your clinical and research interest. Find your passion. Am I ready to give up the other component of this specialty to narrow my concentration? If so, stick to it and be focused. Talk to a mentor. And consider your desired lifestyle. But don't apply for 2 subspecialty in the same institute. You will reduce your chances of getting selected. So when do you start the fellowship? Go when is best for you. Be aware that the longer you are away from training, the less desirable candidate you may become. So soon after your residency is the best time to go for the fellowship. But believe me, it is never too late. So we are lucky to be born in the era of social media, so we can connect to people of our interest through WhatsApp, Telegram, and Facebook. So study the website of various training institutes and read the testimony of past fellows. Find out who the notable fellowship alumni are and what are they doing now. You should come up with a reasonable list, but unless you have a strong aversion, always apply in your home institute as well. Your chances as your own program are likely better than elsewhere, especially if you have been a star in your residency program. So fellowship actually introduces you personally to a new organization seeking talent. Reach out to a faculty, alumni, and advisors. Getting the personal account of their experiences will give you insight that you will not be able to find in any brochure. It may be the case that the top institutes you are not necessarily appropriate, may not be necessarily appropriate for you and your work. A lesser known institute might be the home for groundbreaking research which you are interested in. Remember, the place is going to be your second home. So how do you prepare for an interview? Reread your application, practice answering questions, prepare your own list of questions, and be yourself. So yesterday we had a long discussion and what is expected during an interview. Just to highlight few things: sit upright, make eye contact with an interviewer, and be prepared and enthusiastic. You might feel a bit nervous on the day of your interview. Don't worry. Your panel appreciates that it is a significant occasion and you're likely to be nervous. Feeling prepared will help you feel confident. Practice the beginning of your interview well. This will help you to get off to a good start. Justify your choice of institution and subspecialty. So this is a very important slide for me. It pays to note your outside interest aside from medicine. Interviewers are always interested in learning whether you are considering a normal, well-rounded individual. Things like hobbies, sports, music, and other interests and special life experiences often show them whether this would be a right person to have on their team. The purpose of the essay is to tell a bit about you. Think like a TV ad that you have very little time to catch the audience. Keep it personal, interesting, and short. Talk about your accomplishment that exhibits you, how you will be perfect fit for that fellowship. Try and show some genuine passion when you are talking about your accomplishment. Don't fall in the trap that thinking that your accomplishment is too small. The fact is, relating a small accomplishment that is in line with which the company values can be more powerful than an unrelated accomplishment. Certainly put your best foot always forward, but always be yourself and be truthful. After many years of the game, most interviewers have a sense of the good ones out there. So I feel motivated to share my story. So when I was applying for a fellowship in one of the reputed institute in 2014, I had nothing in my resume to impress the interviewer. It was too dry to impress anyone. The only thing which the interviewer picked from my resume was something which I have written at the end in very small fonts, that I'm a national level chess player. And my whole interview revolved around chess. Like, I was asked the question how I got interested in chess. Do I still continue to play? Do I want to do anything in future in chess? So I was very surprised to know that I got selected in the fellowship just because of my chess credential. So no accomplishment is small. Let the interviewer decide that. And to end my presentation, I'll say, if I can do, anyone can do it.